procedures in pediatrics tend to be slightly more challenging to perform, whether it's even setting a line, depending on the age of the child. Even simple examinations, like just tell an adult, just open your mouth. For a child, you must dance, you must sing, you must beg, threaten, cajole, turn upside down. So it can be challenging in that sense, and so people actually tend to not want to just go through that hell of pediatrics.
Welcome to Voices in Learning. Let's explore what learning really sounds like. Today, we will be diving into how child's health affects their learning and behavior in school. And we are excited to have our doctor that has built a community which he calls the constituency in our midst today. Welcome, Dr. Rena.
Thank you so much. Glad to see.
Dr. Ayodele Rana is a consultant pediatrician with over a decade of experience. He is also a social media influencer and a health content creator, known as the Noisy Niger Pediatrician on Instagram, where he shares free healthcare information and education with over 170k followers, reaching 3 million accounts monthly. Dr. Rana is a co-founder of Adness's Care on Demand, a digital health platform providing tech-driven health solutions, including home immunization services. He has been nominated for several awards, including the Force of Wellness and Health Influencer of the Year. He is also Gates Foundation goalkeeper who advocates for health equity and improved child survival through vaccination and good nutrition.
Okay. So please, I would like to know what inspired you to become a pediatrician.
So my father is a pediatrician.
Oh, it runs in the family.
He's a professor of pediatrics.
Oh, okay.
So funny enough, when I was growing up and I saw the books that he would bring back from work and the pictures of very sick children, with all sorts of funny deformities, I was like, who willingly chooses to do this to themselves? Who signs up for this kind of thing? Even at a young age, before I actually knew what hygiene and, how to, pay attention to hygiene, I was always very cautious with touching anything that he brought from work. I was very cautious of touching him because I kind of just knew instinctively, yes, that's coming from a place that they were likely to be transmitting viruses and germs between themselves. So I was almost certain that I wasn't going to actually become a pediatrician. But when I got into medical school and I saw how passionate the pediatricians were about making us as medical students know the things that they knew, it was really a case of they think these are really good mentors. And children are just amazing in the sense that they really don't have any room to pretend that they like you. They don't have room to pretend that they are not well when they are well. And so you literally see the transition from being terribly ill to being full of life and energy and health. And that really is such a gratifying feeling. And so I think people, particularly mothers, are so much more grateful for you helping their child get better than even making them get better, themselves. And so it really, there's that emotional payback, I think, that happens with pediatrics that I think you just don't get anywhere else. Maybe except the O&G when they deliver the but at that point, immediately after, the mother is like, Abeg. After the first time, of course, mother's excited, like, but after 2-3, mother like, Abeg, wait first. Eat first, but the rest, they do not look at the baby. Okay, you are here, Abi. Okay. But every time a baby gets better, a child gets better, the mom is just as happy and just as excited as if it's the first time the child is falling ill.
So how has it been for you? As in, are you excited about it, or okay, I know you're excited about it. I should not ask that question. So how has it been in terms of challenges? Has it been challenging, or it's just been easy peasy like every other medical field?
Again, pediatrics is very challenging. I think it's one of the most challenging medical specialties, and this is why a lot of people actually don't do it as a specialty, because it can be quite stressful. It's very difficult to deal with a patient that can't talk. It's also very difficult to deal with anxious parents and family members. Also, procedures in pediatrics tend to be slightly more challenging to perform, whether it's even setting the line, depending on the age of the child. Even simple examinations, like just tell an adult, just open your mouth. For a child, you must dance, you must sing, you must beg, threaten, cajole, turn upside down. So it can be challenging in that sense, and so people actually tend to not want to just go through that hell of pediatrics. Then when it now comes to the residency program, training in pediatrics, of course, most places between 4 and 5 years, but it's fun, very fun.
Outside medicine?
Yes, outside your
6 years?
Yes, outside your 6 years.
Wow.
So you have to do a postgraduate of about 4 to 5 years to finally qualify as a pediatrician. In that time, of course, you are required to conduct research, you're required to teach, you're required to present yourself for examinations to make sure that you are competent and essentially competent to care for Nigeria's children or children anywhere in the world, because they really are one of the most vulnerable groups, and very small errors can be very costly for a family. And so these are the things that I think would constitute challenges. Again, when people say things like, they say AI is going to take my job, and then they now look at the camera and say, when? Well, pediatricians we are dancing into it as AI should not even take our job safe. We're happy doing all the dancing. So the challenges, but I think at the end of the day, it makes it all worth it. And if you look at how much specialties are paid, pediatricians are actually one of the least well paid. Yes, actually. So if you look at if you go to the US, where they actually grade how much physicians are paid based on their specialty, pediatricians and geriatric people actually are paid the least, with of course people like anesthesia and of course the surgical specialties like neurosurgery and orthopedics earning the highest. Of course, that's because again, their own training is more intensive, and I guess the risk as well is probably higher in terms of litigation. But anyway, not everybody can be an orthopedic surgeon, and people need pediatricians at the end of it.
In top of my head, I can tell you that pediatricians should be one of the people that should be paid more. Reason being that we know how people cherish the young ones, and everybody wants to find the right fit for the young ones. So it's not. But sir, if you start your own clinic, I'm sure we will all move because we need a doctor we can talk to.
That would be nice. I guess again, there's an economic sort of angle to it, in the sense that when adults have economic value, such that these are breadwinners, these are people who are supporting families, supporting communities, and so the premium placed on saving the life of an adult is so much higher than that's placed on saving the life of a child who is just drinking milk, chopping your food, breaking your television, jumping on top you.
Those are your people.
Yeah, they're my people. So, but again, you are still spending on them. So a child is a very long-term investment, and the returns don't come on. Of course, when the returns come, it can be immense. For instance, if you give birth to a whiskey, as far as you don't be thanking God that you allow yourself to go and be going to one studio, your leg back.
Oh my God.
Again, having children, it's a gamble, and which is why I'm religious, which is why you pray every day, that one is, guided and led to actually raise a child, because it's an investment, an intense investment. And it's not just for the family, really, it's for the whole society, because I certainly hope that child actually is somebody that will do things that will resonate throughout the community.
All right, so what is one thing you think parents or the society misunderstands about children's health?
So I think the society actually believes that children, number one, require a lot of drugs. I think we are a little bit too hyper-focused on giving drugs, such that whenever I say, we don't need to give you any drugs, you almost get the sense that there's disappointment in that situation, in the sense that I came all the way and you say, I'm literally not going to give me any drugs. Like, okay, I'm not going to give you any drugs. Which is why you find out that, and I think again, it's really like a sort of tight walk, between the healthcare workers and the community. Because I think at some point, healthcare workers are actively giving babies things like ampiclox, and antibiotics to go home with after delivery, children that actually don't need it. And of course, that's, even if it doesn't, that's a very safe drug, but again, it's unnecessary. So essentially, I mean, when it comes to myths or misconceptions that Nigerians have about the health of children, is that people feel that children need drugs all the time, and nothing could be further from the truth. The reality is that children, like, let me give you an example. I'm not sure whether it started from the healthcare workers, whether it started from the community, but the idea of giving newborns antibiotics like Ampiclox when they are born to take home is wrong, but now patients have come to expect it. So we're also those people that will give antibiotics and anti-malarial just because. We're also those people that must always have our child taking some kind of multivitamin at every point in time or the other, so our kids are so on just one drug or the other at every point in time, cough syrup. When a patient comes to me and I'm like, no, I'm not giving you a cough syrup. They seem almost disappointed.
So what will support the cough?
So the reality is that most cough syrups don't actually work. So this idea that, I'm having cough, I'm get cough syrup, my dear, if the child is more than 1 year, just go and look for honey to give the child to drink. Home remedies, lemon, ginger, get a humidifier, do steam inhalation. Those seem to actually have a better effect on cough than most of the over-the-counter cough syrups. For me, as an adult, cough syrup, if I take it 1 hour, I'm hawking again, but you're supposed to take the cough syrup only to talk less of that young, child. So if it doesn't work for you as an adult, there may be 1 or 2 that I've used that. Okay, not bad.
Because of the faith they have in it. It's just like when you take paracetamol, you won't have headache. That's the faith people use for cough syrup also.
And even people that don't need deworming, they're always asking for deworming medication. So when
do you deworm, sir?
When it's not as if you're living inside gutter. So
we are not getting a lot of things right then.
So WHO recommends that actually for environments like ours, where more than 50% of the population has worms, so it's carrying worms, we should deworm our children every 6 months, starting from the age of 1 year.
Okay.
But again, one would actually want to stratify Nigeria a little bit, because again, if you look at it, Nigeria is a very heterogeneous society in the sense that you find out that those who are super wealthy, super rich, always buy from places where things are packaged, and then there are those people who are not so well to do, of the lower social demographic status, and they don't have conditions that are exactly ideal, such that they don't have access to clean potable water. Their sanitation and waste and sewage disposal is inadequate and suboptimal. They are more likely to be exposed to worms on a regular basis. And I've actually recently managed a child that was actually pulling out worms, so was really ill, was pulling out worms, so it was clear to me where they were coming from. But I'd be surprised to find somebody that I was managing in Lekki, that would be pulling out worms. If I saw a child that was in Lekki pulling out worms, I'd be highly suspicious of child abuse of some sort, because that's not expected, because everything is washed, cleaned. So for those sorts of children in Lekki, I might just say, okay, maybe let's just deworm once a year. But for the ones that are staying in places where it's likely that they'll be exposed to worms, I'd probably say we can even deworm as frequently as every 3 months. So it really should be taken in the context of the situation that the child is living in. So I guess my point really is that the major, misconception that Nigerians have is that children must always be on drugs, and if you don't give drugs as a physician, then there's something wrong with your license or your brain, or both.
Yeah, I know. My son is 8 years and he's never taken a malaria medication. This is because if anything is wrong with the child, we take the child to the hospital, run a test to see what is going on, and most times they'll just say viral infection, and they'll give us I think they'll give us paracetamol and ibuprofen. Most people, the first thing they will say is to get malaria medication. It's malaria, anti-malaria, it's malaria. So that's the mindset here.
Yeah, I think the mindset that we've all inherited, because again, my mom, despite the fact that her husband is a pediatrician, before school resumption, I don't have any symptoms, but she would still give me anti-malaria. Before exam, she would give me anti-malaria. When before I travel, she would give me anti-malaria. So essentially it's something that I think has just been inherited. But the reality is that I think our healthcare system too, any healthcare system really, has its barriers, to access. So things like waiting times actually, they're a barrier to access, because it's just like, why would I go all the way to the hospital to go and wait to see a doctor for 3 hours when Shebi, I can just walk into that chemist and then just give anti-malaria. Big. So it's just the idea of just going to that place. But here's what the problem is. You see, when you decide that you want to treat on your own, and then you give the anti-malarial or the antibiotics, and then it does not work, and you still eventually have to now come to the hospital. We have to still now run the test. You have to wait that you don't want to wait. And unfortunately, if you've been treating the wrong thing, then the condition might actually get worse, particularly for infants. That's children that are less than 1 year. So for the older children, they've seen all what has been possibly seeable, 5 and above. Short of drinking out of gutter, there's nothing that they have not done.
The one that even bust my head is the people that live abroad and they still buy malaria medications when they are going, and I'm like, hello.
Well,
as in, is there malaria there? The malaria is here now. Is that mosquito there?
Yeah, you don't know what village people are capable of.
They've shipped malaria to them. Okay.
Just hold on to it. Because I think when they are traveling, because they've been in Nigeria and they've been bitten by mosquitoes, it's kind of like, okay, maybe even if they've not really been bitten by mosquitoes, but just being in the environment.
So when they get there, they will isolate them. Malaria was isolation straight.
So eventually they just don't take any chances. So when they get there, if they have any small bitter taste in the mouth like this, they will just use it. Yeah.
I have exciting news for students. Airpeace is officially partnering with Voices in Learning this season. Drum roll! As part of this partnership, students traveling on the London route can now enjoy a 15% discount on flights with Airpeace. To qualify for these student discounts, individuals must be enrolled as a full-time student in accredited educational institution in the UK, Europe, USA, or Canada. This initiative is about supporting dreams, easing travel for students and families, and making global education more accessible. For more information, visit www.flyairpeace.com or click on the link in their bio. Thank you.
Another thing I would like to ask is what should parents look out for to be sure that their child is developing well? So this developmental thing is a big topic that I would really want us to emphasize on, in terms of at the end of the day, the child you don't know, so you attach the child's developmental problem to maybe something that was maybe vaccine or something. So how do you know as a parent, as a mom, that your child is developing well?
So this is where well child clinics actually come in, because we don't really pay attention to well child clinics. There is a recommendation actually for most pediatric professional bodies, including the Pediatric Association of Nigeria, to say that there is a certain frequency with which you should actually bring your child to the hospital for an evaluation, even if they do not have any complaints at that time. And that is so that we can detect any deviations from what we expect, so that we can screen for certain conditions that become apparent only at certain ages. And we can offer what we call anticipatory guidance, in which we try to tell you what to expect in terms of development and growth as a certain phase of life approaches, and to offer reassurance to say that this deviation is not out of the ordinary, even though it is probably not what happened with your first or second child. And you're wondering, but my first and second child, they were able to do these things by this age. But this child, even though hasn't achieved it the same way in which your older siblings did, but is still within the expected range, and we are not raising any red flags yet, that sort of thing. So when it comes to development of course is very complex, and it's a very fine interplay between the brain, the environment, and the body. That being said, there are various domains of development, including the motor domains, which involve movements of large parts of the body, like the arms, the neck, the trunk, and then the fine motor movements that involve movements of the hands. And then you have social and language. You have social development and then language development. And so we have very specific timelines that we expect children to achieve certain milestones. Let me just give an example, because again, development is really wide. So we expect that an infant should achieve what we call a social smile between the ages of around 6 and 8 weeks. Now, a social smile, yes, is a smile in which a child smiles upon being given a social cue. So, not those ones that when they are sleeping like this, that one is not a social smile. Social smile is a smile that the child performs in response to a social cue, like smiling at the child, making a funny face at the baby. Meaning that as early as 6 to 8 weeks, the baby should understand that, well, this person is offering me a social interaction that I can respond to. And of course, the more he sees that you are responding to his smile, the more he smiles, and the more he understands that, oh, there's a social context in which I exist. So, if a child is not having a social smile at 6 to 8 weeks, so if he doesn't have it by 6 weeks, we're okay. Doesn't have it by 7 weeks, we're fine. Doesn't have it by 8 weeks, we're fine. But if by the 9th to 10th week, the social smile has still not appeared, it might mean several things. It might mean, one, the child is not seeing, because you have to be able to see a face to respond to it. And the human instincts, we were wired right from birth, is that we are wired to look at other human faces. So don't be too surprised or alarmed when you're walking on the road and somebody is just looking at you, that this is wired into their brain to stay. So they might not be seen. Two, they might not not understand the significance of the interaction, such that they might actually have a behavioral or neurodevelopmental challenge like autism. Autism can actually begin to show as early as 6 weeks with the absence of a social smile. And then they might actually have what we call a learning disability, or what we used to call mental retardation or intellectual disability, where they are unable to register that this is a process that should involve me offering a response back to this person that is trying to give me some kind of cues to smile. So these are all the various possibilities. Now, when it comes to the ones that parents usually focus on, include things like walking. Oh, it's not walking yet. It's not crawling yet. So those are the gross things. But we tend not to pay attention to the social milestones, because we almost expect that where it's a baby, they should just acquire it. But things like waving bye-bye, being excited at playing peekaboo around 9 to 10 months, so things like that, are very important. The other thing, of course, that parents are concerned about is the speech. But I find out that usually they come to us maybe around 2 years when the child is saying absolutely nothing. I've seen sometimes they actually, as matter of fact, 2 years is generous. They usually come at 3 years when the child who should be saying everything is not saying anything at all. Whereas if a child is not babbling by 10 months,
what was
if a child is not babbling by 10 months to 12 months, which is around 1 year, then the child needs evaluation to see if the child is hearing. Because you need to be able to hear speech to try to repeat it. The babbling is actually in the baby's head. The baby is actually telling you, I want milk and I don't understand why you're wearing this color. It doesn't suit you. But all that is coming out of the baby's mouth is la la la, So the child is actually, trying to develop language skills. So if by 10 months, so meaning that some children with speech delay can actually present to us as early as 10 to 12 months. But because they did not come for the well baby checks, and we did not ask
it's not available. Please, sorry to cut you. Corona, say abroad, when you take a child for immunization, they check before any form of immunization. They're checking the body of the child. They're checking if the child has diaper rash. They're checking the length of the baby, the weight of the baby, a lot of things. They are checking the mouth. They're checking. But here in Nigeria, when you just go for immunization, health centers, for instance, they just do baby weight and that's it. The baby weight, the length, and also give immunization. Do you understand?
Yeah.
So as a mother, I will be so excited to know that there is a place where I can take my child to without. So I only go to the hospital when my child is sick. So I would like to know if my child is eating the milestones. I would like to. I understand what any intervention does. So if there, I think we should really talk about it as places like that.
Well, I get what you mean, Sha. So maybe again, it's a sort of like a dual role that maybe not a dual role, but the community and pediatricians and healthcare professionals actually need to play this role together in the sense that maybe we are also not emphasizing it as much as we should, because in all fairness, the healthcare system is a little bit overwhelmed with the challenges, with very basic challenges, you know, things like diarrheal illness, pneumonias, meningitis. We're still battling to deal with the ill children. So to now add the well children, particularly in the public sector, to now add the well children to the mix outside what is done at the immunization center. And the immunization people, they see the hero, that the crowd that normally comes on immunization day, and they now come and say, now come and meet, Madam,
Before I carry the baby.
Carry the baby. Want to give the baby injection.
Carry your baby.
Be going.
The cure.
So so these are challenges, but I totally agree with you. Actually, I think the emphasis on well baby clinics will help us to detect these deviations from what is expected in terms of development before it gets to a stage where intervention becomes difficult, challenging, or even impossible.
So, Dr. Rena, we've not ended the impact of as how you can know how you can get it if your child is not developing well.
It has.
So now I'm going to where you find out that your child has speech issues. Is it something that can be corrected if you catch it early? For instance, if you get it from you are opportune to have someone like Dr. Rena around you, well baby facility around you. So if you catch it like 10 months, are there things you can do to support the behavior of the child?
So it really depends on the cause of what this developmental delay is. So for instance, if we find out that there are some causes of developmental delay that are progressive, and what we mean by progressive is that no matter what you do, it's going to get worse. The development is going to keep on getting worse and worse and worse, and they're never going to recover in any way, shape, or form. As a matter of fact, there are some of those metabolic conditions in which the condition will progressively get worse. But fortunately, most of the conditions that cause developmental delays are non-progressive, meaning that if left alone, it's not likely to get worse, but it will not improve unless you intervene. So, early detection is very important so that intervention can be instituted as early as possible. The intervention will depend on the kind of developmental delay that we find. So, for instance, if it is speech, one of the first things that we do is that we assess hearing. So whether the parent tells us that, he's hearing because, when there's a loud bang at home, or when there's a, sudden noise, when they hear their favorite cartoon, they run to the television. So in spite of all that, we actually still do a hearing assessment, because hearing again will depend on the frequency of the sound, the volume of the sound, and so they might not actually be hearing like conversational speech or volumes, so we say, we still need a formal hearing screen. Once we've gotten that and we've taken a thorough history, do a physical examination, ask for things like hearing screen, evaluate for neurodevelopmental challenges like autism.
Can you evaluate very early?
Yes, you can evaluate very early.
How early?
As early as 18 months. There's a questionnaire. It's called the modified MCHAT is not what we call it. I don't remember the full thing. MCHAT, where we offer the parents a questionnaire to actually fill, to just say, so it has very simple questions, things like, so does the child bring you their toys, to offer you the toys to play with? Do they bring you into their space to
play with
them, to play with them in the same way in which they're playing, and for instance, when you point at something, are they interested in looking at that thing and bringing it to you, or things like whenever your child is on the streets, do they point at things that they're interested in for you to look at as well? So things like that can actually tell us, if the child has high risk for autism or not. And once we've done that questionnaire and the child is high risk, then we can actually now do a more thorough evaluation in person, observing the child and his interaction with, people, to see if, there are signs, of autism, So most of these developmental delays require a multidisciplinary approach, meaning that it's not just a pediatrician that is going to manage. We're going to have to send to the ear, nose, and throat people to assess and evaluate hearing. We're going to have to send to the speech therapist, the physiotherapist, if there's any delay in, walking that we have pinpointed to obvious musculoskeletal and nervous system issues like cerebral palsy. And so we just get an army of professionals to try to help us find out what is going on. And of course, we have to involve the education, the schools as well, depending on how early or how late it is that we catch them. Because again, quite a lot of children who have learning disabilities or learning difficulties, might have developmental delays in speech. And we just, say that, this child is just not talking. But the child is actually not able to learn very many things. And that might become obvious in things like significant delays in toilet training, significant difficulties in following simple instructions that are appropriate for the age. You should be able to tell a 3-year-old, go and bring me the red cup on the table in the kitchen, that kind of thing. So if they're unable to follow those kinds of instructions, and in conjunction with the fact that they can't really speak, then you need to begin to suspect intellectual disability.
Okay, so when parents are looking at milestones like walking, you mentioned that these are even the least. But are they part of what we should look out for in terms of crawling, walking? Could they also be a sign of a child having a form of disability?
Yes. So for instance, I mentioned cerebral palsy. Now, cerebral palsy is a condition in which a child actually has difficulty with movement, posture, or coordination as a result of a brain injury. So the brain was injured, but the manifestation is difficulty with movement. And usually the brain injury occurs in the growing and developing brain, meaning that either the child was in the womb or generally less than 5 years old. And so the injury or the insult happened. Even if the insult has come and gone, the after effects will still be there in the form of
babies follow. When you are breastfeeding and you are tired, just sleep and the baby will just meet the baby on the floor.
Well, fortunately, actually, most falls in babies actually don't result in cerebral palsy. Most cases of cerebral palsy in Nigeria here come from what we call birth asphyxia or perinatal asphyxia, in which the child did not cry immediately after birth, which is the commonest one that we see, even though quite a lot of cases of perinatal asphyxia actually occur before the child is even born. The brain is already starved of oxygen in the womb. And by the time the baby now comes out, the manifestation of that oxygen starvation is actually the baby not crying immediately. So meningitis too is a very important cause of cerebral palsy because it damages the growing brain and then affects hearing, movement, and various other aspects of development. So development is such a huge aspect of child health. Unfortunately, again, there is just such a huge lack of neurodevelopmental pediatricians in Nigeria. We are just managing the thing for us.
Okay, so I also heard that kids regress. So it's possible that your child has all this, has developed well, suddenly the child stops.
Yes, regresses.
So what causes it also?
So regression of milestones is something that we encounter. Now, the regression of milestones can have very many causes, including infections, malnutrition, certain types of drugs, and various other metabolic issues. I can't think of any specific diagnosis now. Well, maybe one comes to mind. We call it Duchenne muscular dystrophy. Very rare, there's just unfortunately it's rare things that you'll not be remembering. But it's the child might develop well up to a certain point and then might not have difficulty standing up and walking because the muscles essentially are weak. But yes, there are conditions, particularly infections, of the brain and the spinal cord that can actually cause
How can a child get infection?
That's what I was trying to say. It is children that get brain and spinal cord infections more than adults. More than adults.
Where are they getting it from?
It's usually from the environment, viruses that they catch. And you see, that's why, infections are so strange. And the reality is that do everything within your power to avoid catching an infection, because you can know where that infection will start. You don't know how it will end, because an infection can start off as innocently as just a fever, and by the time it becomes complicated, it will be brain inflammation, brain swelling, encephalitis, sepsis. So as much as as pediatricians, we realize that most infections in children are mild and self-limiting. There will be those few ones in those few children that just have a specific predisposition to develop a type of complication for reasons that we are unaware of, that they will just go from
small to serious.
As from 0 to 100 in a few days, and then we are battling all sorts of things, So that can cause regression in milestones. Now, for otherwise healthy children who suddenly develop regression, that is a more challenging situation, in the sense that, of course, we have to take a history in terms of family history of something similar. Is this a genetic issue? Most of the time, when children have regression of milestones who were previously healthy, it's a genetic issue. It's something in the genes, and we are really still in the infancy of genetics and genetic studies here in Nigeria. And so it's not an aspect of the field that I am entirely familiar with, because I can read the books and say, okay, this will cause regression in milestones, for a previously healthy child. It's unusual. It does require that if that exists, or if that occurs, that they see a neurodevelopmental pediatrician as soon as possible for evaluation.
Okay, so while we wrap up, I have questions for you. I've not been asking questions, we've been discussing. So these ones are the questions. These are the questions. Okay, so I think we've answered most of the questions. So I want to bring it to the learning aspect now.
Okay.
So, how does a child's physical health affect their academic performance? And what role should schools play in protecting children's well-being? How can schools and parents work together? Better together.
So, sorry, could you repeat the question?
Okay. So the first question is, how does a child's physical health affect their academic performance? The second question is, what role does school play in protecting children's well-being, and how can schools and parents work better together?
So, physical health related to school performance, I think, really, the human body is a very interesting thing, and it needs to, I think the biological goal of every human being is survival, such that if your body is forced into survival mode, it's going to do the things that will force it to survive. So, if the child is malnourished, for instance, the brain is not going to be worrying about how to put book into the head, because there's no iron, there's no zinc, there's no iodine, and it is going to mobilize those resources to keep the child alive rather than intelligent. So it's going to help the thyroid to function better so that metabolism is maintained, and the brain is going to suffer for that. So no matter how much information you try to give this child to assimilate,
it won't work.
It's not going to work, because the brain has, managed to redirect resources to where it is required. Of course, that's not to say that there will not be children who have nutritional challenges that will not be motivated enough to learn, but think of how much more potential they would have had if they were fully nourished. Recurrent illnesses, repeatedly falling ill, and missing school, of course, I think is one of the more obvious examples of how the physical health of a child can affect school and schooling. So whether it is recurrent admissions, recurrent absenteeisms from recurrent viral upper respiratory tract infections, those absenteeisms from school actually can result in academic challenges and the child falling back. Children with chronic illnesses, whether it is sickle cell anemia, whether it is asthma, we talk about the quality of life for such children to say that, because again, learning is a holistic and a full experience. It's not just about sitting down in the classroom. It's about physical activity, playing, physical education, that interaction that involves you immersing yourself into the entire experience, not just in the classroom. So, a child who has uncontrolled asthma, for instance, cannot engage in certain kinds of physical sports, even if they wanted to, even if it will give them all the fulfillment in the world. So, how are we managing that asthma? How are we trying to make sure that they are on medications that prevent them from developing, an attack in the middle of a very important race or a very important, because children with asthma don't need to be excluded from those sorts of things. What matters is that they are well controlled on their medications. Children with sickle cell anemia, for instance, the pain can be debilitating. So if a child with sickle cell anemia is missing school 3 times a week because of pain, then it means that something needs to happen. That being said, the school environment, I think we all know children actually spend more time in school.
And when they go to school, they come back home with infection.
At home. And when they go to school, it's not the school's fault. It's the fault of their colleagues. It's the fault of the other children in school, because as soon as one person is recovering from one,
another person is collecting.
so, and they are bringing it back in a circle. So, in terms of the collaboration between parents and teachers and the school system, helping to safeguard the health of children, their roles are very important. So, for instance, I know schools that actually mandate that no juice, no fizzy drinks, it's just water and your food and your snacks, just to try to foster that lifestyle, that lifestyle of good health, making the right and better choices. And that of course ultimately, makes the parents interested and invested in doing that. Of course, when you get home, you can do the occasional treat, and nobody is saying that you absolutely cannot give your child soda. It's your child, you can do what you want. But we all know, if we're being honest with ourselves, that those things should be limited as much as possible. So I think there's room for parents and teachers to collaboratively safeguard and improve the health of children.
In my head, I would say schools are doing that because they don't want the kids to be hyper on sugar. So they don't want wahala. They just like, please, you can bring your children drinks at home, but don't bring them here when they are hyper. Okay, so what are the early warning signs of developmental delays? I think we talked about it. And when should parents seek professional help?
Okay, so this is where knowledge is very important, and I'd say please equip yourself with knowledge. There are developmental milestone red flags that exist. So for instance, if by 8 weeks your child is not having a social smile, contact your doctor. If by 5 months your child is not holding up the neck by themselves, you need to contact the doctor. If by 18 months the child is not walking by themselves, you need to contact a doctor. If by 1 year the child is not babbling at all, you definitely need to contact a doctor. So those ones I think are the most poignant ones.
Crawling.
We don't really care about crawling, because some children they just go straight from sitting on bum and they just stand and they begin to run away. So crawling, we don't really pay so much attention to crawling, but these are how those milestones go.
Okay, I remembered something. So I know parents talk about TV, screen time, and developmental growth. So what do you have to say to that?
When I did the baby convention 2 years ago, 2024, screen time was one of the conversations that we had, because of course we didn't have that much screen time because television didn't even come on until 4 o'clock. with the rainbow bars, but now there is a screen everywhere you go. The reality is that screen time has not necessarily been associated with developmental delays. there's been no clear-cut association, but there is a clear association between screen time and inattention, screen time and hyperactivity, because a lot of these shows are designed for very fast-paced, loud, bright, and so when the child leaves the screen and is now beginning to look at you, that your color is so dull. It's like, what's really going on here? And so their attention span actually decreases, and they are more interested. And when they are not with the screen, then they are really hyperactive. So it can worsen hyperactivity. It can actually be associated with inattention.
What about speech?
Yes, when it comes to speech skills. So a lot of parents tell me that, but there are a lot of educational shows that help children to acquire speech. But what I find is that speech is always a two-way sort of communication. So the character on the screen can actually ask them to repeat certain things after them, but
Miss Rachel.
Yeah, not it. Please, Miss Rachel is goated though. Please, you don't Miss Rachel slander.
No. No, my daughter is 8 months and she claps. We clapping. So she likes to clap. We waving. She's waving at Miss Rachel. But if I say we clapping, she looks back because she knows Miss Rachel's voice. Yeah, but we can't allow Miss Rachel. Like maybe 2-3 minutes. Miss Rachel. Yeah.
So Miss Rachel goes. She has saved the lives of so many parents around the world. But people cannot. The child cannot talk back to Miss Rachel. It is to get context, to get the nuance of body language, and that can only come from you interacting with another person. So a screen does not replace interaction. As great as acquiring a vocabulary is on those shows, the idea of a child speaking back to an adult who can actually correct tenses, correct grammar, offer comfort in the face, facial expression, nothing replaces that. And so while again speech delay hasn't necessarily been associated with screen time, but it can affect how well a child communicates. So it will affect communication, but not necessarily delay speech.
Because the child is hearing, the child is not giving back.
It's not giving back.
So when you're having a conversation, there's
two-way. Yeah.
Okay, so my last question before something else is, if you could give one essential piece of advice to every parent about child health and safety, what would it be?
One. It's always difficult to give only one piece of advice. I would say, and I know this will sound crazy, but I would say trust your instincts. If you think something is wrong, something is usually wrong. That is my experience for a mother, for parents. Don't assume that it's nothing. Go to the hospital and let them say that is nothing. Let them evaluate. But trust your instincts, because I trust your instincts, to say that. As well as sometimes, over time, when we've done this profession for a long time, and they enter the room, I can actually, once I hear the first 3 words out of their mouth, I can actually predict how the rest of the conversation will go, because I've seen this over and over again. But I believe that you should trust your instincts as a parent. If you think something is wrong, then something is wrong. Seek help.
Thank you, Dr. Rena. So now I would like you to talk to us about Dr. Rena, what Dr. Rena does at the moment. How can we enjoy your expertise? Where do we meet you? How do we find you? Aside from we are talking to your constituency member on IG and other social media platforms. Yes.
Okay, so I'm Director of Medical Services at Agnosis Care on Demand, which is AGNOSYSCOD on Instagram. So please follow Agnosis Care on Demand on Instagram. That is where you will get my expertise.
Not on DM.
I'm not in the DM. My manager that is in the DM for sponsorship and brand collaboration. Yeah, so at Agnosis Care on Demand, there's a link in the bio that can help you to register on Noisy Moms Group for a subscription fee of 5,000 naira per month. where we answer simple non-emergency health related questions. This morning I've already answered the warming question. I've answered cough and catarrh question
for free for us on Voices in Learning.
As in, I was on the noisy mom group actually.
Okay. Oh, okay.
Yes, I've answered, the warming question. I've answered question on cough and catarrh. A child was snoring. I've dealt with that this morning as well. Yesterday, of course, I had to deal with a rash, in the child. So we trying to say, don't go and spend 4 hours waiting in the hospital for something that we are going to still tell you that we're not going to give you anything for. So on the Noisy Moms group, we just, answer those questions. And of course, we also do home vaccinations and diagnosis care on demand. So those are the things that I'm doing currently. Of course, I'm working on various projects, including a book for new parents to help guide them.
We need it. Parents need it.
Yeah, through the first 3 months of life when the baby arrives and they are doing things like this and they are doing things like that. And the parents are like going to watch them to see if there's someone breathing, so things like that. So the book is going to come out very soon. So watch out for that.
So you mentioned something about something pediatrics during the conversation where we can check while we take our kids for vaccination, or a place we can check the growth of kids. You mentioned something like that.
Oh, so as I said, I thought about that's Pediatric Association of Nigeria.
No, there's a particular thing you talked about.
So Well Baby Clinics, at this time, Agnosis does not run Well Baby Clinics, but it's in the works.
Okay.
And at the end of the day, really, we would also like to expand and actually just do a proper clinic where we'll have Well Baby Clinic.
Very important.
And yes, just because you can never have too many pediatric practices, around, really, because at the end of the day, some parents will actually still need the advice of a specialist. Well, of course, most generalists can deal with the basic, child health related issues. But again, there's a touch that a pediatrician will just bring that is just different, just because of all the experience and all the knowledge that has been accumulated over the years. So I also, of course, organized the baby convention, which is...
When is it coming up? Because we are coming.
Yes, so baby convention this year, we're planning it for November, so we'll keep you posted. Okay. And in baby convention, we discuss education, because last time we discussed actually, screen time, we had some education vendors, that were at the event, nutrition, breastfeeding, we have that time, so that the dads, of course, are always involved. So it was a really exciting thing, and please look out for that as well.
We will. I think that is all. Is that all we need to tell ask Dr. Rena? Thank you for joining me on Voices in Learning podcast. I would like to know what stood out for you. Connect with me, share your thoughts, and let's keep the conversation going. Until next time, let's keep exploring what learning really sounds like. Thank you.